current situation we are facing that is dealing with a pandemic. Many people may be anxious of the unknown. Many
Okay.
people have lost
All right.
jobs. Many people are and lost jobs and are
Okay.
depressed.
Right.
So we are hoping that this conversation will help you cope or manage some of your problems. So on hand, we have Dr. Julius Gilliard. Did I get it right, Doctor?
Yes, you did.
All right.
Fully
Uh,
inside of a
a psychiatrist at the St-Lucia National Mental Wellness Center to inform us and guide us along this path. So take it away, Doc. Can you give us a little background of you?
Yeah, actually, I no longer work at the wellness center.
Okay.
I am exclusively in private practice.
Okay.
Since September last year, I am a psychiatrist. Studied medicine in Cuba, so I speak fluent Spanish. Then I specialize in psychiatry in Jamaica. I started in Jamaica and moved to Trinidad after the first half of the program for personal reasons. I, I graduated in 2017 and I've been back home since then. Father of one boy who's a teenager, so I guess all of you all know what that means. And I love what I do with a passion. So that's it.
Oh, great.
It's actually a dream, you know. Since I was a teenager, I wanted to do this. So
Nice.
I'm living my dream.
Um, that's nice. I thought of that too, but then when I see the really TikTok ones, I'm like, I don't think I can do it.
They're not as scary as they seem.
Really? All right, no, I've seen some really serious ones.
They're not as scary as they seem. Don't worry.
Okay. Okay, so can you tell us a little more about mental health, what it entails, what it's about?
Mental health is one of the most misunderstood fields, I think, in medicine, because a lot of persons only think mental illness. And as long as there's no mental illness, then everybody seems, or no obvious, I should say, obvious mental illness, everybody feels okay.
Right.
Now, mental health goes along a spectrum. So you may have persons who may feel mentally well, who may not show mental illness, but may have some difficulty in certain situations. So you may not have that difficulty in one situation, but you have it in other situations.
Right.
You also have persons who have difficulties in lots of situations and who are difficult to, or challenging, I should say, when it comes to personal interactions and even dealing with day-to-day situations. So you could say mental health exists along a spectrum, and a lot of us take it for granted. So a lot of us prefer to go see a cardiologist or a skin doctor or a neurologist, and we tend to neglect our mental health. We feel, oh, I'm just feeling a little depressed, that will pass.
Right.
Or just somebody did me something and I feel very angry and that will pass. Or my girlfriend leave me or my husband on me or whatever and I feel away and that will pass. But no. Your brain is a very sensitive and very complicated organ. And so we should always do our utmost to ensure that it remains as well as possible, because of all the body organs that we have, the brain is the most important. And I cannot stress that enough, because your brain controls every last one of the functions of the rest of your body. Okay, so what we're going to speak about today, I mean, I didn't do many slides, but we speak a lot more of, well, apart from the slides, but mental health in general. And I'm sure a lot of you feel that you are separate from persons. And that's one of the issues with mental health, is that persons with mental illness a lot of the times feel ostracized. So they feel like persons reject them or persons look down on them because of their mental illness. But we are all unique in our own little special way. I'm sure if I give you all to fill out this identifier, you will realize that most of you are similar. So who am I? So I am a brother, a mother, a manager, a friend, and I am religious, a musician, cancer survivor, female. All of us have identifiers that are similar. So we are all joined in some manner. We are all similar in some way. So trying to push away somebody because they don't meet the society's definition of normal is actually what we call stigma. We will go into stigma in a little while because a lot of persons feel stigma is just the outward and obvious rejection of persons. But no, a lot of us do it very subtly without even being aware. And a lot of times it comes from the things that we say. So let's look at some of the things that we say, no? Mm-hmm. How many of you have said some of these things? So these are commonly used stigmatizing language.
Yeah.
How many of you have said some of these things?
All of us. All of us.
I think I've used every one of them there.
Yeah, so these are stigmatizing words, and we're not even aware because it's things that persons around us use all the time, that we use all the time, even to describe ourselves.
Yeah.
Understand? So the thing about the brain is that when you have these little signals throwing around in there, then they all bring up emotion. So if we see somebody behaving in a certain way, we automatically attribute one of those words to them. We're not even realizing that we're stigmatizing them.
Right.
Sure, when I know our country is very homophobic. So when we see a gay person, first thing we would come to mind, bula. Mm-hmm. And so we have an emotion. If the person comes towards us, we feel an emotion as a male. And so that in itself is stigmatizing. Why? Because our mind tells us that this person does not meet the societal definition of normal that we grew up to know. Okay? So that is clear. Any questions on that?
No. Not,
Any
not as yet.
Just one question.
Okay.
Can you hear me?
Yes, I'm hearing you.
If you use, say, for example, you call someone a loose screw, or you just say it in a very jovial, informal setting, is it still deemed to be
stigmatizing language?
Yeah. Is it still stigmatizing language?
Stigmatizing language. Yes. It's not the context that it is used in, it is the language that we speak. And I'm sure, for example, every day you tell yourself, I read stupidly, and you say it as a joke. I read stupidly. Every day you're telling yourself that. Eventually you'll start to believe that,
Yeah.
without you even knowing. Believe that you're stupid.
No, what I meant is even more casual than that. Say like you line with your friends and somebody make a remark.
Stigmatized language.
Yeah.
But just even a one-off statement.
It is stigmatizing language. So you have to ask yourself, why do you use language? So why do you use language? Why don't you tell the person something like, "That's making me laugh," or you funny, or why you behaving that way? Something like that.
So but sometimes in our culture it doesn't come out.
The words
That's
loose.
Right. Because for example,
the words loose. What does a loose screw signify?
Sometimes you in a like a buy a rum shop, you tell a man gas fu, but it's not anything. It's just the setting. That's what I meant. It's still stigmatizing.
Let's look at that. Let's look at that. But let's look at that. What is a bugfu in St. Lucia?
Well,
what do we describe as some fool.
That's what I'm saying
madman,
there. It's a madman, basically someone
Yeah,
is
so, but what does mad mean?
Someone not in the right frame of mind.
But what does not in the right frame of mind mean? You understand? So all of these things are labels that we place on people. We place them on people because we taught them by persons before us. But really and truly, they have no meaning. You cannot see what is inside somebody's head. You can see their behavior, so you know that they're behaving in a manner that is not what we deem to be normal, or they're behaving differently than other persons usually behave. But mad, what is mad? Mad is a concept that we developed, I guess, our parents and our parents' parents, and so it's passed down to us. So all of these are stigmatizing words. I'm not saying that you stigmatize somebody when you use them, but when you use stigmatizing language, it affects the way you look at mentally ill person. So you tell somebody, that's a fool. So what does that mean is that if you're fool, that means you behave a certain way. So then you see somebody behaving that way and you call him a bug fool. Understand? So then you stigmatizing without you even recognizing that you are doing it.
Right.
But
Coming from, or you still have doubts?
I have one question though, concerning that. For example,
Go ahead.
That's what I'm saying about Fuman. I remember in class we did it all the time. We do it on our chat all the time. But I know Wayne is not crazy. I know Petula or any of us are not crazy. But we see it as we're just giving each other jokes and
just to be funny.
Isn't that can that be separated from the actual stigmatization?
So you see, so let's look at that now. So these days there's a lot of talk about sexual abuse, right? Especially at the workplace. And you know, back home we're very nonchalant with sexualized language in the workplace. I'm sure Ketura can attest to that because I used to harass her incessantly at work. Yes, but that is not tolerated in other countries. So we are accustomed to it and we see no harm in it, but then other countries see it as very harmful, and it can be harmful because it can affect person's self-esteem. It can affect a lot of things about the person. So even let's say you don't know that let's say you don't know that Wayne is going through a mental health issue, and as you're making jokes and you say, "Guys, I'll say about Fuman," and maybe he's going through a mental health issue, and unawares to you,
right?
He takes it to heart, and then something happens. Well, let's say he decides he starts to feel hopeless, and he does something that he maybe nobody would have expected him to do. So it's just we have to be very careful what we say because we never know. We don't know what's going on upstairs. So we never know. So somebody might be smiling with you and they're going through a lot of distress, but they don't want persons to worry about it. They don't want to be a burden to other persons. They want to push out their chest and play, I'm strong, I can deal with this, but they're going through a lot of distress. So we never know. So we have to be very careful with the language that we use to each other, especially. It is stigmatizing. Push into a corner with a label, and then it's difficult to let go of that label.
So do you think we have to educate people about that?
Well, we are educating people about it, but persons are very resistant to that aspect, the same way all of you are now questioning, but there's nothing wrong with that. There's nothing wrong, So persons are still very resistant to it, but it is a fact that as long as you label somebody a certain way, the whole mind, we're not even aware of it, but the whole mindset tends to shift towards that label. And then you as the labeler, then what that means is that you have a general view of persons under a certain bracket as being labeled like that. So persons who exhibit that behavior, you label them as that. And that may not be true. Somebody who is running around naked and screaming and so on may not be mentally ill. The person maybe smoked a crack and then started running around naked, or the person maybe got some medication from a doctor for migraine or for another illness, and it affected the thought process and they run around naked. The person is not necessarily mentally ill, but we label them fool. You understand?
Yeah, I think I understand it now. I understand the connection.
We have to be very careful the way we speak. Very careful.
Do you think it affects kids like to us? Well, I know it does, but to what extent? Because we grow up on the island and hearing our parents, it's like a fall. It's like a fall. The very from age maybe 3 and up.
Yeah. So you see the thing, what I'm now starting to discover, because I'm seeing a lot of persons in my age group and well in our age group, because I think I'm the same age as all of you here. So I'm seeing a lot of persons who are now in this age group and saying that they went through the things that children are going through now and it didn't affect them. So I'm fine. That's what they say. I'm fine. But they're not fine. They appear fine. Or they make persons think they're fine, but they're not fine. A lot of them have issues with alcohol. A lot of them have issues with cigarettes and marijuana or cocaine and all kind of stuff like that. A lot of them have issues with their partners. So they either very insecure or they have multiple partners and so on. So they are going through a lot of things. They have a lot of self-esteem issues that they deal with on a daily basis, but they tell everybody that they're fine. And a lot of the stuff, it affects you. We may deny that it does, but it does.
So how can we distinguish? How do we know like when it's affecting someone, this person is just not exercising a certain type of behavior as opposed to they're having, or this is the beginning of mental illness? How can we differentiate? You know what I mean?
Well, by talking to the person. So the language we use to the person would depend on whether the person opens up to us or not. So if you go to somebody and tell them, that's an automatic shutdown. So you go to and ask them, hey, I know you for a long time and I don't know you to be behaving that way. Is there something going on that that maybe you can speak to me about?
Okay.
So that is a much more welcoming message than just what I said a while ago. And a lot of us tend to use what we call closed questions. So it's always good to use open questions when we're asking about mental health. So do you want to speak about this? Is there anything I can do to help? Mm-hmm. Somebody that you can talk to, or if you want, you can speak to me and I can recommend you to somebody I know, those kinds of things. So because when we say, you okay? Are you okay? No, yes, I'm okay. And that's it. You fine? Yes, I'm fine. That's it. So talk to me. I know you a long time and I don't need to be behaving that way. What happened? Talk to me now, man.
Makes sense.
So, doctor, in your practice, what do you think is the #1 cause of mental illness?
In my practice, I would say depression and anxiety, but we'll get to that later. I don't hurry.
Okay.
We just started. What the time? 3:28.
Yeah, we're good. No, I'm good. As long as you're willing to stay with us, we're good.
Yeah, I'm good.
We're good people.
I can tell people as long as it's to spread my mental health agenda, I don't
know. So let me take you somewhere else. Because if someone, I always have that position. I don't believe I understand the mental health 100% like you as a professional, but I think over the years I've tried to understand it. And I always say that the mind, the brain, it's an organ by itself, and it has its own ways of doing its own things. So just as you will have a bellyache, you can have a brain ache or something, and it can lead to mental depression and stress and etc. etc. But it's not like any mental health or mental disease or mental illness. It's not like any other affliction that you will have. So someone comes to you and say, I have a toothache. You know what to do. Go see the dentist, do this, take a Panadol, do something. But where mental health is concerned, to me, it is so specialized that you as the layperson might not be in a position to really address it properly. And you may even cause the person to hide the feelings or not be, I don't know, but probably we don't know how to really address it. So what would you recommend? What kind of, because sometimes in our society, people, they like to know your business. They're not helpful. They want to know what's affecting you. You don't have the solution. Or sometimes the solution that they give you or the recommendation that they give you, it's not in your benefit, but it's in their benefit. They always tell you do this and do that, but it's not because they believe it's right for you, but it's right for them. So how would you advise us as laypersons to approach the whole issue of mental illness and trying to counsel our friends and family into getting help or whatever?
So you see, the issue we have is that fear. A lot of persons fear mental illness, basically.
Yep.
They figure that any mental health issue that they have will lead them to mental illness, which will lead them to a lifetime of drugs and then walk around like a robot, pushing barrow, and those kind of things. So that's that is the idea that we have of mental illness. And even in my private practice, a lot of the persons I see, one of the first things they would tell me is, "Doctor, I'm not sick, or nothing wrong with me, or I'm not taking no pills that making me walk like a robot." So this kind of things that persons come in and they have this preconception that this is what it involves. And that is because of fear. We grew up, and I guess our fathers and mothers grew up in a time where there were asylums. And what were these places? These places were dreadful places where persons who displayed any form of mental illness were thrown into and lived in appalling conditions. So now somebody has an idea of things of mental health, that is one of the first things that their minds go back to. Or being shocked by Rigsby, or running around naked, and this kind of things. So those things used to happen when there was not much information about mental illness. So that, I guess that was the 19th century, the 20th century, sorry, where that was how it was treated. They were given shocks, part of their brain used to be taken out and this kind of thing. That is, all of these things are things of the past, and we still live in that era.
Yes, that's true.
Whenever we hear or we feel that somebody is going through something, we automatically, our mind goes back to that. And so we feel afraid. So we don't want, or we think of suicide. We don't want the person to kill themselves. So we don't know what to tell them, because if I talk to them and they kill themselves, then I go feel bad and this kind of thing. No, we have to be brave. If you don't know how to manage it, call somebody who can. So in St-Lucia, there is a helpline. I'm sure in the US and Canada, if you all are there, there are lines that you can call to get assistance for somebody who you think is going through a mental health difficulty.
So in other words, don't take it on your own. It's better to call a professional to assist.
Exactly. So
okay.
if you feel you cannot manage it, then you call a professional. If you feel you can manage it and you want to know how to manage it, then it's up to you. Google provides everything, YouTube have everything. So do research, find out how to talk to somebody who's going through a mental issue. Find out suicide as much as you can. Find out about the signs of suicide. Find out how to speak to somebody who is having suicidal thoughts. What to do when somebody is having suicidal thoughts. What to do when somebody is depressed. So one of the more important things to do, I'll tell you, is to try to be there for that person as much as possible until they get the help that they need. Because a lot of times we take it for granted. Somebody tells you, "Oh, this happened to me and I feel like killing myself." I say, "Don't worry about that. I will pass by tomorrow. You'll feel better. I'll go for a drink or just go home and chill out, man." And the next day, the person killed themselves, or the person did something that makes you now feel bad. So anybody voices that to you, speak to them, ask them, tell me more about it. And what can I do to help? I know that number that I can call, they can get you help. It's not as, it may seem overwhelming now, but let's get some help to see if we can help you feel better. Those kinds of things. So you stay with the person for as long as you can until they get help, or until they get somebody who can get them to that help, if you don't want to stay there. But just leaving somebody tells you they want to kill themselves and leaving them alone, that is very likely a high risk for suicide.
So, Doc, in a case that someone is behaving erratically, and who should you call? Would you call the cops or a specialist?
Okay, so it depends on that person's relationship to you. So if it is somebody who you're close to, then it would be better to I don't know how the cops in the US deal with mental illness. But instead of the cops, I guess they're a little more trained now than they used to be in the past, so they no longer shoot people who are mentally ill. Like I said, in the US, I don't know what happens.
Yeah, a lot of that is happening in the US. That's why we have that big thing about defunding the police, meaning that they want them to allocate monies to things like that. So when the police has to respond to someone who's mentally ill, they would come with a psychiatrist or somebody to guide them.
But by right, the police should not be responding to mentally ill.
Most times they do here, and what they do, they shoot to kill. There is their way of dealing with stuff here.
Very sad. But anyway, the ideal thing is that there's a group of persons who are on call, consisting of a psychiatrist, a psychiatric aide, a psychologist, a social worker, and some mental health, what we call them, aides. So persons who, maybe big persons who can manage the mentally ill person if they're not coming down when they approach them. And that's the ideal thing, is to have groups like that in each community that can respond to mental health emergencies as they arise. And who persons can reach out to if they're having difficulty, like Mr. Wynn asked about. If you cannot deal with the person or you don't know what to do, then you call that group and they attend to them.
Okay. What is the difference between a psychiatrist and psychologist?
Psychiatrist is a doctor, medical doctor who specialized in psychiatry. A psychologist is somebody who did psychology as a first degree, psychology as a master's, and psychology as a PhD. So the psychologists go more in depth with counseling than the psychiatrist does.
Oh, okay.
So let's move on. So what is stigma? It is a mark of disgrace associated with a particular circumstance, quality, or person. And like I said earlier on, sometimes we stigmatize without even being aware of it. Okay, I think we pass that. So our beliefs. I think I was saying that earlier on. Our beliefs about certain groups of persons and things influences our behaviors towards those things. So if we feel if we're stigmatizing mentally ill persons, automatically when we encounter one, we're going to have a lot of negative emotions about that person. And that is because of what we believe that person to be able to. Other persons believe that you're mentally ill and automatically you're dangerous, and that is false. That is false. If you look at the prison system, you will find that 80 to 90% of the people in there have no mental illness, or rather I should say no obvious mental illness. Understand? So you don't have to be mentally ill to be violent. Mental illness, somebody with a mental illness has a higher risk of violence, but generally, persons with mental illness are not more violent than the ordinary person. Okay? Now, even our beliefs about on mental health, like I said earlier on, can have a negative impact on the way we see ourselves. So a lot of the times we feel depressed and we see ourselves as just something I'm going through, it'll pass. So I don't need the help. I don't need to go and see a psychiatrist because that's for mad people. And I don't go and see a psychologist because that's for people that have real problems. And it's just depressed, I depress. You understand? And then the depression gets worse and worse and worse. And actually depression, untreated, can lead to psychosis and can lead to all other kinds of mental illness if we don't do something about it.
Okay.
So what I want you all to do is to think back on a time that you were stereotyped or stigmatized. So some of you live in the US, right?
Yeah.
And you've gone through that, right?
Oh, yes.
Okay. So that is what mentally ill persons face on a daily basis. On a daily basis. And even from persons who care for them.
Yeah.
Any other staff at the wellness center will tell you, you part of your memoir because, see, I pick up on all of those little body language and so on from the staff, and I tell them, I mean, what can I for if you going to be stigmatizing against somebody who's mentally ill. You understand? So,
yeah.
So we have to be very careful. We have to be very self-aware when we're dealing with mental illness, but not just because of the person, but because of ourselves. Because we having that negative attitude towards somebody who's mentally ill, if we're going through some mental difficulty, we will feel that we don't need the help because maybe the person who we go to may treat us the same way we treat the mentally ill person, and that's not true.
Mm-hmm.
Be very self-aware of that. Okay.
Yeah.
So would you feel comfortable receiving help and support from the people who made you feel different?
Maybe.
Really? So the policeman that pull you over and because you're black and rough you up, you would want to get help from him?
And I was just about saying it depends on the circumstances. Maybe in that case, no, you already,
Exactly.
Stereotype.
Made me feel whatever.
Mm-hmm.
No, thank you. But to me, it depends on the circumstance. When a person probably don't even know better, like we're saying, certain little names that we used to call people that we don't even think. We look at it as a joke. And if then the person did it and apologize, and then as wants to help, I'll allow them to.
But you still have a negative emotion about that person.
Yeah, but eventually it will change. Like I told you, it depends on the seriousness of what was said or done.
So let me give you an example. So I had this patient, actually a white lady, who was going through a lot of difficulty in St-Lucia. I think somebody had beat her up and threatened to kill her and so on and so on. I mean, I was not aware of any of that. So one day she saw me and then she had disappeared for a few months. And one day I saw her, she came to my office and I was like, hey, you alive? She didn't tell me anything. A few sessions later, she let me know that she really didn't appreciate me asking her if she's alive after she was going through all of that difficulty, killing her and so on and so forth. And then the person who she expected to be there for her, I'm asking her if she's alive and she gave my business. What did I say? I just had to very humbly apologize. I could have gone on my knees and do happy with myself and apologize. But there's nothing I could have done. I just had to move on from there and remind myself that I have to be very careful what I say to people because I never know what they are going through. So it's a similar situation. We have to be very careful how we speak to persons, and we also have to, when we feel a certain way, when somebody tells us something that makes us feel a certain way, we have to let them know that whatever they said makes us feel that way, and we would prefer that they not do it. And we should do it at that moment because we never know what might happen later.
Yeah. So I'm sure when you apologized to her, she was willing to.
I mean, she was a bit resistant, but then I mean, I'm a professional, so I know how to get through to persons who have kind of negative attitude. So I mean, the relationship, I had to start back building the relationship.
Okay.
And move on from there.
So let me ask you a question, Doc. In that instance, for example, you made the comment about are you still alive? You asked the question about are you still alive, and you apologized to her, which we all get. You personally, do you feel that it was an offensive comment or?
Yeah, well, looking back, it was an offensive comment because I didn't know what she was going through.
Okay.
So we have to accept that our comments at times are offensive, and when somebody lets us know that your comment is offensive, we have to accept that. Okay, we have a lot of pride, huh? So we say, but it's nothing I told you, and so usually somebody would try to defend themselves, but from profession, I know that once you try to defend yourself, you're only creating more discord. So the first way to prevent discord is to accept when you made a boo-boo. I made a boo-boo. Let's move on from there. Okay? Tend to be very hard-headed with like, oh, but a little thing I tell you and getting on so and this kind of thing.
Right.
No. I'm very sorry. Okay?
Yeah.
Mm-hmm.
So, has there ever been a time in your life that you felt any of these? Any of you? Let's start with Farai.
I'll tell you the honest truth. Let me see. Depressed, anxiously. There was one time when I was younger, in my 20s, and I was going through some stuff in Montreal, having been a young black man, you know what I mean, having dreads, having beard, and being stereotyped by police and other people out there. There was one time when I was missing my family so terribly up here, you know what I mean? But I had to continue. I had to continue with my life. And there was some point I didn't think of suicide, but I said, I wonder what is suicide like. I wonder what someone who wants to think of suicide, what thoughts go through their head. And then I talked to someone about it, and I was told that if someone wants to commit suicide, they won't speak about it. Because if you really want to do it, you won't let anybody know. If you talk about it, that's what I heard. I don't know how true it is.
That's the myth. That is a myth.
That is a myth, I think, yeah.
That is a myth.
I've heard that so many times that if somebody really wants to kill themselves, they won't talk about it. They just do it. Because they don't want you stopping them, you know? Yeah, so I've thought of what it is to commit suicide. I never thought of doing it, but I've thought of what it is. You know?
Well, let me ask you a different question. At that time, you had some kind of counseling. So somebody who could have helped you go through that period. Do you think you would have come out of it better or dealt with it better?
Yeah, I think so. And in hindsight,
I'm sure it was available to you. Huh?
Yeah, it was. But like I said, I didn't even know I was out here. I was young, and so many things I've learned over the years. You know what I mean? Like this is one of them that is very close to me when it comes to mental health. Because me living in Canada, I've seen friends. I used to see friends, and I go to the house and they'll just be lying down on the couch. I don't know what to say to them. I never knew it was depression. Years later, I found it was depression. You know what I mean? So I get to understand it a little more because I've had people very close to me who have been affected by it, especially in this country up here. And then me staying here and seeing it happening, so many people in St-Lucia is being affected by. I'm trying to wonder what is the difference between here and St-Lucia, because it's our society here. You kind of understand it, you know? But then you're seeing so many suicides and so many cases of depression now on the island. You wonder where did it come from? You know what I mean?
It didn't come from, you know, it has been there and now it's being noticed.
Okay.
So Doc, could there be like circumstances where someone is depressed and not know?
Yeah, because it's the same stigma. So persons go through depression and they feel it is just something, I just feeling a bit low today, you know, and that will pass. It goes on for 2 weeks, 3 weeks, and say, okay, I need to do something about this, you know. Let me go and take a shot. So they go to the bar and they start to drink and they get into a different kind of issue. So it distracts them from the depression, which is still there, never dealt with. And now they have 2 issues to deal with, depression and alcohol addiction. You understand? Or they might say, depressed, let me go and check this girl down the road. And then they go and check the girl down the road and then get the girl pregnant and
more stress.
Deal with.
Yeah.
Understand? Yeah. So we feel depressed, but a lot of the times we try to deny that we're feeling depressed. We tell ourselves it's just a little thing, you know, or little thing I'm going through, I'll get through that.
Okay, so do you think someone who's going through depression, can they pull themselves out of it on their own?
Definitely they can, but the majority of persons who go through depression don't have that luxury. So you have different persons at different levels of resiliency. So somebody who maybe has a large social circle, somebody who is close, has somebody who they can confide in, who they can, debrief to and so on. Those persons tend to be more resilient. Mm-hmm. Somebody who has a good self-care regime, so they exercise regularly, maybe they go dancing every now and then, they go for a massage, they do a lot of things to take care of themselves. So that person will be more resilient than somebody else who is just home, work home, does not belong to any group, does not do anything much. So that's why I commend you all, because even this kind of social setting is good for all of your mental health. Just having somebody there that you can turn to, somebody there that you can speak to on a regular basis is good for your mental health.
I'd like to comment on anxiety, which I think is something I've been through. Back in the 90s, I had a little health problem, And then I ended up going to the hospital, spending a couple of days in the hospital. And coming out of the hospital now, I realized taking the train and or taking the bus or being around people, I just used to have this certain feeling like there was one night I was home, I thought I was having a heart attack. And I had to call my lady. I said, "Yo, I'm dying." I said, she's like, "No, you're not dying." I said, "I'm dying." And I didn't know what to do. I swore, I never had a heart attack, but I swear I was having a heart attack. You know what I mean? Went to my my doctor, a naturopath doctor I was seeing, and she recommended something called rescue remedy for me. And she also recommended meditation. And from that time, I started taking meditation little by little. Me personally, it helped me a lot. You know what I mean? But then I'm seeing the anxiety thing. Anybody else who have had anxiety and they talk to me about it, I'm able to tell them, yes, I've been through it and what to do. So the levels of anxiety, can you speak on it for me, please? The levels of anxiety and how bad can it get?
So I don't want to call it levels. You see, person's mistake, there's fear and there's anxiety. So fear is a normal reaction to something which we perceive is going to be harmful to us. And fear is the body's normal reaction to that. So we have a release of what we call corticosteroids and so on, which cause the fight or flight response. Problem with anxiety is that anxiety is usually a prolonged period of increased fear response. Especially now with all this COVID thing going on, anxiety persons now have anxiety up in the roof.
Yep.
You being on edge a lot, so for a long period of time, that will start to affect your mind and your body. But your mind, because your mind controls your body.
Okay.
So what anxiety is worry. Okay, now that symptom you must have. Worry, and you cannot stop yourself from worrying. So if, let's say, you're going through a financial difficulty or something else, or some other personal challenge or an illness, and then you start worrying, oh my gosh, oh my gosh, oh my gosh, oh my gosh. And then you start to not sleep. And then you start just feeling tense and on edge. So you feel like, you know, those wound up toys, you just always feel wound up all the time. And any little thing you jump, then you start to forget things. So you start to have difficulty concentrating. And then you start having this fear like something bad going to happen. That is anxiety. Now there's a difference between anxiety and panic.
Panic, yeah.
So panic is one form of anxiety, but it is not necessarily anxiety. So persons with panic symptoms, what they have are what you described. So the racing heartbeat, they feeling like you're choking or you cannot breathe. You start to sweat, cold sweat. You start to tremble. You start to feel like you're going to die. You maybe some persons might feel dizzy or woozy, and it really is like a surge of fear that you have. It usually lasts for a few minutes and then subsides just as quickly as it started, and may start again and subside soon. Okay, so that's panic.
Panic.
Some persons, it kind of wake them out of sleep. So you sleep in and just wake up and you feel your heart going, and you feel like you're going to die. That's panic. Okay, now that can develop in anybody. It can develop at any time. You never expected when you came from the hospital you would start having those symptoms, did you? Right. So it can happen at any time and can happen to anybody. How you deal with it is with medication, depending on the severity, medication and counseling. So let me put up I call it, rating scale for you. Let me see who is anxious here. Give me a second. Huh? So let's do a little exercise now.
Okay.
You can see that clearly or no?
I could.
Yeah, I could.
Okay, so all of you fill out that. Tell me what scores you have. So over the last 2 weeks, how often have you been bothered by the following problems?
Nervous, anxious, on edge, nervous, For me, I had a little nervousness, but I think I'm just going to be honest with you. I had a little nervousness last night because it's our first time hosting. It's my first time hosting such a meeting. So I had a slight nervousness as the technicality before doing everything. Is it going to work properly and everything? I had that little nervousness last evening. You know what I mean? Stop or control worrying. I'll say maybe 2. Worry about little things or different things. I'll say 0. Trouble relaxing. I'll say 0. Being restless.
Now, I'm sure if you look back on the time where you felt when you came out of the hospital, a lot of these things you were experiencing, right?
Yes, yes. For a while, yeah. I experienced them quite almost every day for a couple of weeks, I'll say.
Anybody here scored over 15 on that?
Let me see.
I scored 9.
Okay, so that suggests that you have mild to moderate anxiety, yeah, Katura?
Okay.
I have a 10.
I have 9.
Anybody else?
Yeah, I got 9.
And
about 10. So it suggests that 10-9, that suggests mild to moderate anxiety. So that means you have some level of anxiety dealing with at this point. Okay, so what I would suggest to those persons who have the 9 and the 10, you do something about your physical health, because your physical health impacts a lot on your mental health. So exercise, if you're not exercising, exercise, watch what you eat. I don't know, do something new every day.
Yeah.
New. So join a club, go on and walk in the park, try to rebuild your relationship if it's suffering, do some research into stuff like that, maybe learn a new language, try something like a new instrument or something, get a pet, stuff like that.
Okay. Because I used to do yoga, and I noticed when I stopped it, I was more relaxed when I was doing it. And now that I haven't done it in a while, well, because of the circumstances, people can't really go to gyms and stuff. I don't have the, how should I say it? I don't like doing it on my own. I like doing it in a group. Now, because of what's going on, we can't do group stuff anymore. So I notice I'm getting a little edgy now. So I'm thinking maybe I should get back into doing it on my own.
Maybe you should get back into doing it on your own.
I have 2 questions. First of all, what effects does diet have on your mental health, and are there any special foods one can use to help with mental health, or specific foods?
I'm not a dietitian, so I really cannot respond to that question. I like to draw the line as to what I know. If I don't know, I'll tell you flat out I don't know. But fat foods, I know for sure. Fast foods cause mental health issues because they actually increase your risk of dementia later on, so Alzheimer's. So if you are overweight now and you're middle-aged, then what I would advise you to do is try to drop some of the weight, because overweight is one of the risk factors for Alzheimer's. In fact, activity in general. Okay.
Yes.
So let's do another rating scale. Then.
Okay.
You can see sorry.
Oh, it's too small.
So for the last 2 weeks, how often have you been bothered by any one of the following?
I have a 6.
Anybody else?
I have a 7.
Anybody else?
Don't be shy, people.
I have 5.
Thought that I would be better.
So this is a depression rating scale. 5 to 10 is usually mild to no depression, 10 to 15 moderate, and 15 and above is severe depression. So anybody with 15 and above probably should see a mental health professional as soon as possible. Okay?
Yeah,
there was something I wanted to mention to you all. So let's look at something interesting, which I'm sure a lot of you may. Where is it now? Let me look for it. So let me share that. So you know how people usually, when you see somebody who has poor self-control, we tend to look down on them and say that person full of crap, the person drinking or behaving bad always and very impulsive and beat their woman or involved in crime and this kind of thing. We say that they have poor self-control. Yes?
Yeah.
And society tends to look up to persons who have optimal self-control. So we tend to look at persons with good self-control as being upstanding citizens. They may be religious or not, maybe looked up to by their peers, admired for their good sense of self-control. But some of those persons tend to overdo it with the control. So they tend to end up to the extreme of control. Now, what happened to those persons is that they tend to have a strong focus on, let me just sing up a little. They tend to have low emotional expression. So they have difficulty expressing how they feel. They tend to be very performance oriented, always have to move forward, always have to do things, always have to be in front and very striving, but they often feel very lonely. Okay, those persons, people would call them control freaks. I'm sure you all know a few of them.
Oh, yeah.
Being control freaks. So they have a strong desire to be correct and to help. Now, correct is not being right, but being correct in my attitude and my moral standard and so on. Very correct person, and you would see it a lot in, especially in churches, persons who are very, up there, and we probably give them names as well, stigmatize against them, and they tend to want to help others a lot. They perform well, they value rules, they believe in fairness, and are very perfectionistic. Okay, so they often self-sacrifice to ensure others are careful, and those persons they would secretly resent this. So they would say to themselves, I there for everybody and nobody there for me. I'm sure some of you that already, right?
Oh yeah.
and they can't tolerate delayed gratification. So you wouldn't find them being in multiple relationships. You wouldn't find them somebody just come to my house and say, let's go out. They'd say, I always have to plan ahead.
Right.
Okay. So this person.
So are you saying that in itself is a disorder? The
We'll get there. We'll get there.
Oh, okay.
We'll get there. Okay, so those persons were probably born that way, so they have low reward sensitivity. So somebody may walk up to them and give them a bouquet of flowers, and they're like, yeah, okay, thanks. Okay, cool. They may do well at work, and they may give them some kind of reward, and they're like, yeah, I know. I mean, it wasn't nothing. No, I mean, yeah, I do my best, but that wasn't much. That I deserve all of that.
So, for example, Doc, I mean, not wanting the recognition, really doesn't matter if anybody say anything good about what you have done. That fall into that category.
That's called low reward sensitivity.
Okay, but is that okay? You say we'll get to that.
Yeah, we'll get to that. Look like I pinch a nerve, boy.
Yeah, you're diagnosing me right now.
Those persons also have high threat sensitivity, so they tend to read, like what do people say, overthink everything. Yeah, so they tend to, something happens and they're like, that must be something that happened, or somebody speak to them and they read in the person's face and trying to assume what the person is thinking, and they tend to have high inhibitory control and a high attention to detail. Now, somebody born with that and then grow up in an environment where self-control is crucial. Daddy tells you, you must come home with an A or else, or you have to go to church and behave yourself and be on the right track and all of that. Mistakes are intolerable, and you should not show weakness. You have to man up, or a child like you doing this kind of thing, and always plan ahead. My computer want to go off on me there. Sorry, my battery gone. Back on track.
Don't.
When the dog pinch a nerve.
Yeah, boy. I don't know, but I don't see that a problem for me, but
No, we'll see if it's a problem or not in a while. So we
just don't prescribe any medication.
No. It doesn't need medication. So usually over-control is not a problem, in that persons, like I say, look up to persons like that. So they see them as upstanding citizens of the country, of the society. So they tend to be rewarded for their good performance. But the thing about it is that they tend to feel disconnected from other persons a lot. So they tend to feel lonely a lot. And that's why they call it the hidden loneliness. So they usually aloof and hard to get to know. So persons would always be very private persons who maybe see one aspect, the face that they show in public, but they're really not easy to get to know. So they struggle to connect with people and may be rejected or criticized for being inflexible. All right? So when it causes a problem is when the person starts to feel overly lonely, and that can actually, I won't say it can lead to suicide, but the person can have suicidal thoughts sometimes, or can have a lot of emotions that they cannot deal with. And what I find is that it's a lot of anxiety, but they deny the feeling of anxiety. So they tend to be very anxious because they're afraid to fall short of the perfection that they set for themselves. But they also deny that anxiety because they cannot show anxiety because they have to be, tough.
Right. Tough, yeah.
Understand? That in itself is one of the main issues that can make treating depression and anxiety very difficult. So a lot of my patients who, when I see them just not responding to treatment and so on, I normally go along that path and try to take that thing with them. So one of the ways to deal with it is learning more about yourself. So self-awareness. Because a lot of times we think we have certain thoughts and so on, and we're not aware of where they're coming from. We have certain behaviors that we exhibit and we're not aware why we exhibit them. So self-awareness is very important. And I try to get all my clients to practice mindfulness. And mindfulness is actually recommended as part of this your self-care regime because it helps a lot with depression and anxiety and can actually make you more aware of yourself, of your behaviors, of your thoughts, of your emotions, and so on. Okay. As well, those persons that are recommended that they become more social, so they increase their social network, and that because that is based on social what's called some theory in evolutionary psychology, which states that human beings have survived as long as they have because we are tribal in nature. So whereas the other animals would go around and seek prey and so on, we tend to stick together and we tend to look out for each other. And that's a historical thing. So we put up a fence around a group of us for each other. Somebody calls for help, we go towards them and so on. So we are tribal in nature. And we tend to move around as that tribe and do things together. If somebody starts to go off the deep end, we pull them back because we are like that. So in essence, the bigger your tribe, the more secure and safe and the better mentally you are. Actually, social connectedness is one of the things that protects us from Alzheimer's as well. So as you're getting older, try to build your social network. Try to exercise more, try to practice more mindfulness, try to eat better. All of those things protects our brains from deterioration later on in life.
Yeah.
Okay.
Yeah.
Any questions?
I would like to ask you a question as on you were talking about certain behaviors we growing up and we see certain people acting erratically or whatever. Can you speak on nature versus nurture when it comes to these behaviors? For example, you as a child might see your mom or your dad acting a certain way, not even knowing why you acting that way later on in life. So mental illness when it comes to your genes or your genetics, can it affect everybody in that family, in a certain family? Does it skip a generation? Does it skip one person? Because I've seen it in so many people. Go ahead.
In all mental illnesses, there is something we call risk.
Mm.
So a risk factor does not mean that you will develop the illness. If you have a family, for example, who has had Alzheimer's, if your mother or father has had Alzheimer's, you at risk of developing Alzheimer's. Does not mean that you will develop Alzheimer's.
Mm.
So there is a risk for everything. There's a risk for schizophrenia. If you have a family of mother or father or close relative with schizophrenia, then you are at risk of developing it. If you have a family member with depression, you are at risk of developing it. If you have a family member, mother or father who was alcoholic, you are at risk of developing alcoholism. So there's always a risk as long as you have a family member who has some form of mental disorder.
Okay, because that's
what you have to do if you have that risk is try to do more things to build your resilience. So your father is alcoholic, try not to drink or use drugs.
Yeah.
Your mother was depressed or your father was depressed, try to do things to combat that. So exercise more, increase your social network, join a club, learn new things, take care of yourself more, go for massages regularly, and all of those things to avoid the onset of these things.
Because
if you have in your relationship, deal with it and not allow it to fester, and then you get into issues. So all of those things helps.
Okay.
Yeah. So Doc, but in a time like this, with the pandemic going on, and we can't really do a lot of those stuff, what would you suggest that we?
So that is one of the difficulties with the pandemic and the how do you call it? Social distancing.
Mm-hmm.
It actually should not be called social distancing, it should be called physical distancing. Because we can still be sociable. So I know have Zoom parties and all kind of stuff like that.
Mm-hmm.
The thing about Zoom is that it takes out the interpersonal interaction. So yes, you see a face on a screen, and sometimes you can block out your screen and so on. So persons don't get the back and forth social interaction. For example, you speaking to somebody and you could see the eyebrows move or the different facial muscles and the hands move and so on. You're not having that with the Zoom and all of that. So that can cause a little bit of a disconnect with regards to the social cues and so on. So yes, that is a difficulty, but persons in their homes can do things to improve their mental health. They can get a mat and lie down on the floor and do some sit-ups, do some push-ups, do some side things, yoga, meditate, you know, bust a wine in the mirror for 10 minutes. All of those things can improve your physical health and your mental health as well. So the thing about it is that we tell ourselves, I'm home, so I shouldn't do anything. But the home is just another space. You can use that space, you can maximize that space to do a host of things. Anybody?
Anyone?
No, can I go back to the issue I raised a while ago, or are you still not ready for that?
About the over control?
Yeah.
No, it's not a disorder, you know.
Not really, because what I was saying there, I tend to have a tendency to do a lot, help a lot, but I really don't care about the rewards and everything. Or even when people acknowledge me or reward me, I do not see that as something that's really needed or significant in my life. It doesn't really matter. It doesn't add any more value to me. You understand? So, but you say it's not an issue.
It's not an issue as long as you're not having difficulties in your life. So you see, they call it the hidden loneliness. So you have to be very careful with that. And loneliness can cause other things. So loneliness in itself can be a precursor to things like Alzheimer's disease. So feeling in itself is a risk factor for other mental illnesses. That is why social connectedness is very important. So yes, you're giving out things and you're saying don't bother with that and so on, but you still should have your tribe that you can go to and feel connected with them. If you stay home and just do things by yourself, you'll find that eventually you start to feel very lonely.
No, that part of it I'm covered. Going socializing and all the things. That's good stuff.
But Doc, when you talk about loneliness, loneliness would be to your interpretation or the person's interpretation. If someone likes living alone, being by themselves, just sticking to themselves, and they don't have...
You have to ask yourself why. Human beings are social beings. That's what differentiates us from the animals. We are social, we by nature are social beings. So if somebody by nature prefers to be by themselves, then something is going on that they're not talking about. So there's something, either some kind of resentment or something that's going on that they're not even aware of. Head shaking, but
I'll check that out.
Because we've had discussions before on with each other where a few of us, I'm one, I like solitude. Like I meditate, and when I meditate, I like some. Well, that's one reason. But even away from meditating, I love being alone. I love just staying home, listening to music, watching TV. You know what I mean? And I find comfort in it. So is that a problem? You think, or there is something I'm missing here?
Well, like I said, there's probably something that you're denying, and it's probably something that you should. So you see, self-awareness is very important. So it's probably something that you should look into, try and find out from yourself. Try and find out, why am I like this? And let me see if I can. That book will fit in your chat. If I can put the book in your chat.
Doc, he's only missing the man in Vieux-Fort.
Listen.
Yeah, you know that place, Doctor Man.
Let me see if that.
Your solitude.
Somebody put an email and I'll send it to somebody and you'll disseminate it among yourselves.
All right. Fry, put in your own one. Fry, put in your
Well, he has your number, right, Violet?
Yeah.
So you do Violet and she
you just on my WhatsApp. I'll
send it to your WhatsApp and just send it to you.
Yeah, thanks.
But the name of the book is called Stop Self-Sabotage. Don't mind that, but it's very good. It's a good book to try to build your self-awareness. It has exercises in it. So I'd advise the boy to do the exercises because it is very enlightening.
I was saying, all right, to me, the solitude that some people crave and some people also want to be alone and by themselves, it reaches a point where when some other thing invades your space, you become very irritable.
Yeah.
That is not good.
No. Eh?
You by yourself, that's fine. People come and they talk, that's okay. But when you see people join you and then you is like you cannot handle, I cannot the noise, I cannot handle the talking, I cannot handle this and I cannot handle that. That's
Yeah.
a problem.
Okay.
Really, for me, like I've been living alone for the past, what, 10 years or so. And a few years ago, my sister came up with her kids. I couldn't take on the noise. I was always irritated. I couldn't deal with it. So would that be a problem? Because I'm so used to just being alone, having my own space of mind. When I want to relax, I don't want to hear no noise in my head because I was so used to that. Would you consider that?
Maybe you prefer that because of maybe your job. You have a very stressful job.
Sometimes it
That's
can.
your way of disconnecting.
But for me, I actually enjoy it. You know what I mean? I've actually enjoyed being alone, and I've actually had fun doing it. But then later on, you might say, okay, that's enough now because the family's gone. No, but what do I do now? You know what I mean? After maybe about 3-4 days when the family's gone.
Remember earlier on you said that you missed home a lot at one point, right?
Yeah, I think of home a lot. I think of St-Lucia a lot. Yeah.
So like I said, you could be alone, but try to have a tribe that you can go to, that you can turn to. So somebody could call up and say, "I there alone. Talk to me now."
Right.
So I sent you a book, Ms.
Yeah,
Bullet.
I got it. Thank you, Doc. I'll pass it on. All right. Anybody have questions?
I want to just touch on something.
Me? Hi.
Yes. Somebody said something?
Hello?
Yes.
Okay, cool. So having balance, like there are times you'd like to be alone, but if you're with a group,
yes.
If you're with a group, good afternoon, Wayne. You putting your tongue in my tongue. Anyways. I'm saying, having oh my goodness. I'm saying, Doc, if you have some sort of balance, right? There are times that you'd like to be alone. You like your solitude, you like your moment, you like, But if you're with a group, you're fine being with a group and socializing, etc. You're out there, it is fine. But when you're home, that's your space, that's your time to be alone and to, take in whatever has happened throughout the day or meditate, etc. So having that kind of balance is not wrong. It's not there's nothing wrong with that, right? The solitude and being sociable as well.
No, there's nothing wrong with that.
Hello? Okay, so then wanting that solitude is not a bad thing then. Wanting to be alone is not a bad thing as long as there's balance.
Right. So that's why I said you should always have a tribe, some set of persons that you socialize with at some point.
Okay. Okay, then you're mentally stable. There's nothing wrong with you.
Yes,
why is that so important to you? that you be mentally stable?
It is.
Are you questioning yourself?
Exactly.
No, I'm not questioning myself, but I don't know. Sometimes you may think you do not have a problem unless you speak to someone, who is in a certain profession like you do, and then realize, oh, you do have a problem, because normal people do not act that way, etc. So that's why I asked the question, but I am fine. I don't think I have a problem.
Michael, let me tell you something. In my profession, everybody is normal in their own way.
That's right.
Everybody is normal. The problem we have is that society has its own definition of normalcy.
That's right.
Normal, right?
If you are
Okay.
societally normal, then they tell you have a check. All of us have a check.
Right.
Get your money a check.
Of course, you have a check.
Yes.
You have a big
And
All of us
imagine the doctor have a check. So
exactly.
That's one of the questions I wanted to ask. I wanted to ask, do you think that in society, most of us in society, or more than 50% of us in society have some form of mental illness or worriness or something, some slight
imbalance?
We all do have difficulties.
Mm.
The problem we have is that psychiatry deals with dysfunction.
Mm.
When somebody's difficulties cause them to become dysfunctional, then we treat it. But if you have your difficulties and you're dealing well with your difficulties, that is fine. You emotionally and mentally resilient. So that is kudos to you. It's when it starts to cause dysfunction. So social dysfunction, you staying away from people or having difficulties with people. Work dysfunction, you have problems at your work. Family dysfunction, if you're at school or anything like that, this kind of dysfunction, we try to correct the dysfunction and the person moves on with their life.
When you had a question? Oh, sorry.
I have a question. So we're talking about self-isolation and people wanting to be alone. What about the person who has the constant need to be around? Like it's impossible for them to spend time alone or spend time like one-on-one. They have to be in a crowd there amongst other people, no matter what.
So that's why I spoke about dysfunction a while ago. So if it is causing dysfunction for that person or other persons, then we would have to investigate to see what the person may be going through. Maybe the person is afraid that if they stay alone, they may start getting thoughts that they cannot deal with, or maybe they have been alone in the past and they had some kind of difficulty that aloneness reminds them of, or maybe they're trying to fit in, or maybe they're trying to make everybody believe that they're fine and they're not fine. But if it's causing dysfunction, then we would investigate to see what is happening that the person has that constant.
But Doc, what about the privacy, your privacy and loneliness? I mean, because sometimes I love being around people. I always organize things, people always together socializing, but there are days, listen to me, it's my day, it's my time.
That's fine. Nothing wrong with that. Nothing wrong with that. So
okay.
We always need time to recharge. And if your time to recharge is you staying away from persons for a few hours, few days, then that's fine. What the loneliness we're speaking about is a constant thing. So you constantly want to be around persons and you prefer to be alone. It's a different thing to you recharging after social interaction, because social interactions are very taxing on our brain. Because when we interact with somebody, we have to look for social cues. We have to process all of that and decide how to react. We have to then react and wait for the other person to respond and then read their response to see how to react again. So that can be very taxing on our brain cells. So a lot of us need time to react after that. And the way we would do it is by becoming a bit recluse for maybe a few hours or a few days so that our brains can recover from that.
Okay.
But sometimes the experiences that you've gone through in life, especially certain people, human beings, have you to want to be isolated and be by yourself, because it seems like there always seems to be this negativity when you're, not all the time, but when you're with people, among people, like you can't really take on the negativity. Is that a problem when you can take on negativity in people? You can't stand it, you can't. And I mean, that's a lot right now because of, I mean, politics, the pandemic. There's a lot of negativity going on right now. But if you get to that point where you can't take on all of this thing, is that a problem in itself?
No, I don't see a problem.
Well, you can't.
like I said, it always boils down to this, to the level of dysfunction that whatever it is causing. So as long as there is no dysfunction, if you want to stay away from people who you think cause negativity, the people who, but if it causes dysfunction, then that becomes an issue.
Okay, cool. All right. I guess I'm doing some self-assessment here.
I see that.
Find out whether I'm mentally stable or not. Miss Oops, how is me? Anyways.
I wonder how you talking with my tongue in your tongue.
But yes. Hey,
but Doc, the other question I have for you, is there something wrong with not paying attention to certain things that people see as normal? For example, I don't really care about the model of car I drive. I really don't care about that.
We're in the same boat.
I don't care about exactly. I mean, I sit on the block with the guys. I sit by the road. I wear jari. I wear my all star. It doesn't really matter. It doesn't add any self value to me. Is that something I should be mindful of, that I should control?
No. We all have different value systems. Huh? So that is something you have to keep in mind. So each and every one of us.
Wayne should just add because of his status or because of who he is in society. That's the part that.
Well, comparatively.
Yeah, but I'm in the same boat because I live in the ghetto. Of car. One person see me, they wonder, you sure you're a doctor?
Exactly.
It depends on your value system. So each of us have a different set of values. Each of us place value on different things in our lives. So some persons place value on material things and on social comparison and all kind of things. And some of us don't. Some of us, our values are helping other persons, trying to make sure that our brethren, our fellow man is elevated in some way. Some of us self-sacrifice a lot. Understand? But like I said, it depends on your value system.
Okay.
Like, it's no problem.
I think we have a question from Marilyn. Go ahead.
Afternoon.
Marilyn Robertson?
Yes.
Hi,
Marilyn.
how are you doing? Okay. Concerning the persons who like to be alone. Some of us grew up alone without siblings, and some of us have siblings. Now, I understand the social aspect that we need to socialize, but sometimes you need that quiet space. You need that quiet time. Now, I think it's Kesha who asked about persons right now with all what's happening. They can't stay alone. They always want people around day and night, especially the elderly people. We now have to find ways to get them active, ways to occupy them. So maybe you can give us a couple of suggestions.
Yeah, the issue we're having now is, I said earlier on with COVID, is that there's a lot of fear. So we've now gone from February now, no? From February to now, constant fear. Remember earlier on, when I was speaking about anxiety, I was mentioning that anxiety is usually caused by prolonged periods of fear, because normally when we go through a period of fear, our body and our mind is supposed to recover from that. And there's not been any recovery. It's been constant fear from February non-stop. So that will cause issues. So persons will start to feel afraid if they're left alone, afraid that something bad is going to happen, and so on. So these are classical symptoms of anxiety. How to deal with that is to try to get the person as occupied as possible in the space that they are. So, like I said earlier on, get a mat, let them walk around the room. If it's an elderly person, let them walk around as much as possible. Go downstairs, go back upstairs, play a game or give them some crossword or something if they can manage that. Try to make them as active as possible in the space that they are. If you can't take them out for a drive, can't take them to the beach, then fine, even better. So then they go out and they're able to connect with nature a bit more. If they do meditate, have them meditate a bit more. If they can read, let them read some more. So those kind of things to keep their brains occupied. If you can keep them physically occupied as well. So you can manage the loneliness a lot better.
Doc, you said about if someone says something like, look at the car, me say driving, would that be stigmatizing the person?
No.
Or
depends on why they're saying. So are they saying it in envy or are they saying it in
like disgrace kind of?
Or like they feel a person shouldn't be driving an old car?
Yeah.
You know how many times I heard that?
Yeah, but okay, you know how to dismiss it or whatever. What if certain things are said and it depends the way the person interprets it, the person that you think it to? If the person takes it very serious.
Everybody is different. So there's a phenomenon called social comparison. States is that the more we compare ourselves to other persons, and happier we are. So we see our neighbor buys a new truck, and one time we subconsciously process that and makes us unhappy. And we try to get some kind of vehicle to compare with the neighbor. Or the neighbor puts an extension on the house and we try to do the same to try to compare. So the social comparison can be a source of unhappiness. And that's even with social media. So we go on social media and see everybody with their nice, looking perfect, and we feel away because we feel our life is not as we want it to be, and this woman gave me trouble or this man giving me trouble, and I have less financial issues. And look at these two, and this is a source of unhappiness as well. Okay. And actually, with the young persons, there's something called fear of missing out, which they tend to do a lot. So they go on social media and they see a latest trend, and they want to start taking part in that trend, and because they feel they're missing out on what's going on, and so on. So that is another source of unhappiness. So occupying ourselves in other things that will keep our brains busy and keep our body busy. Taking breaks from social media, so what we call social media fasting. All of that is good because it helps our brains recover from all of that I call it stimulation from social media, because social media is one evil now. What? You never realize you go on social media, let's say you go on Facebook or Instagram and you start scrolling, and by the time you check it, an hour gone and it's still scrolling.
Yeah.
And you wonder, where did the time go? And you say, I prefer to be alone because nobody have to see me scrolling through social media and being embarrassed about it afterwards. I can deal with that in my own little space. So then the loneliness is not from you wanting to be alone, it's from doing a lot of things that cause you to procrastinate from other tasks and not having to answer to anybody for it. So you tend to build that self-procrastination and self-sabotage network or mindset, I should call it. And you look for an excuse of, I prefer to be alone.
So how, sorry, how do we, as if we do have family members who are going through that mental disorder or whatever, how do we help? Does the person have pattern?
What took back I say a mental disorder?
No, but I'm saying, what if the person has some, anxiety, etc.? How can we help? Are there ways that we can help?
So
some of your receptor side is doing already.
Yeah, I think we dealt with that early on, and like I said, repeat.
Oh, sorry. Well, I missed it. I'm sorry.
That's all right.
I wasn't
you attended class late.
Talking with the person.
When?
Assuring the person that you're there for them, and that they can reach out to you if they need somebody to speak to. So it's a lot of assurance and something we call validation. So we tend to not do that with persons, and we tend to invalidate persons' feelings a lot, especially persons going through mental health difficulties. So telling somebody, you don't have to feel that way, just get over it or just be brave. That is invalidating the person's feelings. That can actually worsen the person's mental health issue just by saying things like that. So validating, I'm showing some kind of empathy. So I mean, I cannot imagine what you're going through, but it looks like it's very difficult for you. Would you want to speak to somebody? Is there any way I can help? Those kind of things. So reassuring the person that you're there for them if they need you and that you empathize with what they're going through.
Okay, but is it possible if a family member is going through depression, etc., is it possible that you were not depressed at the time, right? But because the family member is going through that depression, you have gotten to the point where you are depressed as well because you're not able to help the person. And so now you have probably both of you are going through depression. Does that happen, or do you just feel helpless that you can't help the person who is going through depression, or does it mean that you are going through depression because the person is depressed and you are depressed as well? Is it possible for such to happen?
Yeah, it can happen. You see, we try to, I want to say the right way that you'll understand. A lot of the times we try to take the world on our shoulders. So we have to try to ensure that if there is something that we cannot handle, that we accept that we cannot handle it and try to get the person, somebody who can handle it. Because if you cannot handle it, then trying to handle it may cause you a lot of distress and a lot of emotions that you in your situation. So if you cannot handle it, point the person in the direction that they can get to somebody who can manage it for them. Because you cannot save the world. If you think you would save the world, you'll be in a lot of trouble later on because you're going to cause yourself a lot of distress. You cannot save the world if you get the person help that they need.
Okay. So when you need to get help, because I really cannot help you, can't save you.
Marilyn, you want to say something?
To get help when?
I have a question.
Pet, I will deal with that another day.
Somebody has a question.
Yeah. Would you consider a change in sleeping pattern or sleeping habits to be an early sign of mental illness, or if it happens over a period of time, can it lead to mental illness?
Yes, so sleep is one of the more important factors when it comes to your mental health. Lack of sleep does not necessarily mean that you have a mental illness, but it can actually lead to a mental illness. The issue with insomnia, when you first start to not sleep, you maybe decide, okay, I'm not sleeping, that's fine. So you go 2-3 nights without sleeping, and then the fourth night you enter the room and you look at the bed and you like have a sense of dread that another night without sleeping. So you start to do something we call ruminating. And the ruminating can now bring on anxiety. And the anxiety can then lead to depression. And the depression can lead to other things as time goes by. So usually, somebody not sleeping for more than 5 days, I would advise them to see a doctor and let the doctor evaluate them, see if they're depressed or not, see if they're anxious or not, because these are the two pathologies that cause most sleep disturbances, depression and anxiety. So if they're not depressed or anxiety and they're not having any other issue that can cause insomnia, then they'll probably give them a short course of medication to help them fall asleep better and teach them some sleep hygiene tips used to improve the sleep atmosphere. Take out the TV from the room, try to cool down the room a little more. It's dark when you go into sleep. Don't read before you sleep. Don't eat a heavy meal before you sleep. Don't exercise on an evening. Those kinds of things to help you sleep better or to try to bring on the sleep some more. And there are lots of things that you can use off the shelf. There you can use Benadryl, you can use Gravol, you can use those things, and non-addictive. to help you sleep. I know in St-Lucia we use a lot of fake cortisol and this kind of stuff. So all of these things help.
Thank you.
Welcome.
Doc, what do you think is the best therapy? What is the best, not therapy, eh? Do you think medication or therapy is the best?
Well, I don't like medication.
Okay.
Psychiatrists, I don't like medication.
Don't follow out of confidence.
Because it's, according to the man that's singing in Parboy tablets, that is side effects. So people always have side effects. And side effects of a medication can actually cause the person more harm than good, because then it can turn the person away from mental health treatment. So I always try to use medication as a last resort. So everybody has medication is because they need it, not because they want it. I'm actually in battle with one of my patients because he feels he needs a medication. I don't think he needs it, and he keeps coming back and going doctor shopping and all kind of story like that. And I don't think he needs it. And I'm trying to do more therapy with him, but some persons, they just, I don't know. Some persons have come to me and just want a pill. Doctor, I just want a pill. I don't know what to talk to. Like, really that talking to thing. So I just want a pill so I can feel better. And that usually does not happen. Caroline, you wanted to ask something or say something?
No, I was just telling Petula, most of us, a few of our receptor sites burn already. The wane, so sometimes you'll give us a little counsel and advice, but they might need a little more help.
Me bagay.
So, Doc, do you think kids, I can't remember if I asked that question, but kids, do they suffer from depression? And how early?
Depression depression is no, it does not choose your age or your gender. It can affect any age, any gender, any race.
But would their symptoms differ from that of an adult?
Children usually show depression through things like social withdrawal. They start doing poorly at school, whereas they used to do better. Very irritable or troublesome, as people call them. So your child was nice and quiet, all of a sudden get very troublesome. Very likely the child might be going through depression. Threaten suicide or refuse to go to school or start to really misbehave and so on. So irritability is one of the things we look at. Whenever you see a very irritable child, we think first depression and then other things.
Doc, let me ask you a question into the society that you practice in St-Lucia. How difficult is it, or how common is it that people link mental disorder with the occult? I find in St-Lucia,
it's very frequent, very frequent in St-Lucia.
Always link some mental disease to the goddess. Is Malay do you, or you paying for something, or something?
Very good question. I was thinking of that question.
Yeah, it's very common in our culture, and it is something that the mental health practitioners have to deal with on a daily basis. So I have no quarrel with anybody who come and tell me is a spirit they put on them. That's fine. So you can deal with your spirit as you wish, and no issue with that. And we have to look as well at the other side. So if the spirit is affecting you and the medication is helping, so while the medication does what it does, try to take out your spirit. No problem with that. So I never discount anything like that. The person has their beliefs, that's their beliefs. So discounting somebody's beliefs is invalidating them, and persons don't like to feel invalidated. It tends to put up more of a resistance when they feel invalidated. So validate the feelings that the beliefs that they're having, but you have to treat the underlying disorder. And you have to be very political about it when you're doing stuff like that.
Dr. Gilliard, Conditions such as dissociative disorder, well, ADHD, a lot of us know about it, but dissociative disorder, a lot of us do not know about it unless, we interact with persons like you or clinicians, or, we have persons that we know who have it. The thing is, we live in a society where, I guess, when I came in, because I came in very late, so I don't know how much you covered. A lot of us could be in denial because in my mind, I'm okay, I'm normal. But you seeing my everyday interaction movement, you can tell that something is imbalanced.
Chak, we call it.
Well, yeah, in our local parlors, we say chak.
You have a chak.
So, how do we go?
Marilyn, what, like, the song, a horn is a horn, when you take it on, the same chak, a chak is a chak, only when it causes some kind of difficulty. So if it's not causing any difficulty, then you find if you're chak. Who am I to interfere if you're chak?
In that case, I wouldn't say that you're fine with that chak, because that chak, you're doing something, but to you're not the one doing it. It's me doing it.
Maybe somebody is suspicious of somebody else. Well, that's a different issue. And I said earlier on, we only deal with mental issues or disorders when they become dysfunctional. So if the person is suspecting somebody else is doing them something, then that would cause some kind of social dysfunction and it would need to be treated.
No. I'm saying with dissociative disorder, I'm the one doing something, right? But I'm not the one doing it because I don't accept it. It's me.
Okay, but it may not be you, because with dissociative disorder, you dissociate, so it's not you doing it. Right. So we have to, you see, persons with dissociative disorders normally have a lot of underlying issues, and it's persons who were abused as children. So they some kind of abuse, and the mind could not deal with the abuse. So they dissociate at times when they get very, very emotional. So they have a huge wave of emotions that they would not know how to deal with, and so they dissociate, and maybe one of the other personalities would come up to put up the brave face and to deal with the emotions. Themselves to dissociate. So we have to look at the cause. So my office, you come into my office, one of the first things I would tell you is that here we don't judge and we don't blame. So we look at the cause and we try to deal with it. So dealing with the cause is a lot more efficient and effective than judging and blaming and saying why.
Okay.
Why is, let's do something about what is causing this.
Okay.
So there's usually a cause for any behavior, and finding that cause and dealing with it works a lot better. So whether the person feels it's not them and we feel it's them, not important. What we have to do is find the cause, deal with the cause, so that the person can be as functional as possible in their social, occupational, school, church, whatever group that they're in.
Right. Okay. Would you say that insomnia cases are brain related mentally? When I don't see you, would you say all insomnia cases, persons who do not sleep properly, would you say all the cases are mental?
No, somebody asked that earlier on, and no, insomnia does not signify a mental illness.
Okay. Or something wrong with your neuro? No.
Not necessarily.
Okay, great.
Sometimes somebody just going through a period where they can't sleep properly, and if it persists is when it becomes, like I said, it causes dysfunction. So if it causes dysfunction, then we treat, or then we investigate and treat.
Okay. Thank you.
Doc, would you recommend therapy to someone who has gone through who've had a traumatic experience?
Most definitely.
Okay. So you don't wait till something.
No. You try to process the emotions around the trauma, so that the person does not develop PTSD.
Okay. Thank you.
So folks, I'm going to have to stop you all because it's getting late.
Oh, thank you very much, Doc.
It's a lot of fun.
We spent a long time with you.
Yeah, I learned a lot. It seemed like we just started, man, but very informative.
Yeah, we could go on and on and on, but
if
thank you very much.
Future down the line, so in next year, possible to have another session with you?
Like I said, as long as it involves spreading my mental health agenda, I don't mind.
Perfect. Gwyneth, you have anything to say?
I'm nothing much right now. I just want to thank you for volunteering your time and your knowledge to us. We've learned a lot. I'm sure a lot of us here have. It helped us in some way.
Bluetooth coffee.
And we, yeah, the doctor said. And then we'll be able to pass on the knowledge and check ourselves on some of the things that we used to do. When last year Munfu, and
one of my lecturers had been saying there are 3 types of people in the world. We have the mad, the very mad, and the mad to rat still.
Okay, we got to start checking on ourselves, and because maybe we need to change some of our, what we grew up knowing by our parents calling us names and stuff like that. We're gonna have to work on changing that kind of behaviors. Anyway, Doc, thank you very much. Have a good night.